First thing we should do, following a one-to-one sit-down of course, when working with our clients, should be to perform a brief visual examination. In this examination, we should look for faulty patterns such as inspiratory position of the thoracic cage, neck muscle activity, shoulder protraction, TL junction hyperextension, and again rib flare. Inspiratory position is essentially a raised chest and found in those with relatively higher anxiety and stress levels. They are also the ones with faulty diaphragmatic activity and lack the ability to involuntarily achieve expiratory positioning. Neck muscle hypertonicity is seen in those with tight trapezius levator scapula and scalene musculature, and also found in those who suffer from chronic tension type headaches. Shoulder protraction, which hopefully most of you are aware of, is essentially the fancy term for rounded shoulders. Thoracolumbar junction hyperextension pretty much goes hand in hand with those who display huge sausages for erector spinae muscles and one big extension hinge in the lower thoracic to upper lumbar region rather than multiple extension hinges throughout their mid-thoracic region. Rib flare we already talked about, but just know that this often goes hand in hand with TL junction hyperextension. Each of the above visual examinations can be performed in multiple positions, and since we are dynamic beings who function in many different positions, I encourage you to perform your visual examination in at least 2 of the 3 positions of seated, supine, and prone. Upon visual examination, it is important that we test our clients. Since oftentimes our faults and dysfunctions can simply be corrected via cueing, we should just check to see if simply asking our clients if they can depress their rib cage in the first place. If they can, and they can hold it, we're good to go. Some of your clients may not know what you're asking of them initially, so all you need to do is ask them to exhale as forcefully as possible, without shoulder protraction, or simply cough or laugh. Again, just get them to blow out as hard as possible, but under control, making sure that they don't protract their shoulders or extend their neck, and you'll see them get into expiratory position. When they do this, the body's need for intra-abdominal pressure asks the ribcage to depress into proper positioning. Our 2-year-old boy on the left lacks proper ribcage depression, while our young lady here on the right possesses near optimal, though not perfect, depression. To me, the best way to assess for this is in the supine position. Once they can achieve this, however, we must look to see if they can control this and maintain it with upper limb movement. Again, this can be performed in 3 different positions: supine, seated, and standing.